So I'm going to do a video on metabolic syndrome. The importance of metabolic syndrome is that at the level of metabolic syndrome, if you recognize that there you can take precautionary measures not to get diabetes, type 2 diabetes, not to get some cancers, not to get Alzheimer's, not to get Parkinson's, not to get heart attacks and strokes, the ischemic vascular diseases. So uh, that's the importance of knowing about metabolic syndrome. Metabolic syndrome is now it is understood most of our blood vessel problems and also our diabetes are due to some inflammatory condition. Inflammation is that you are getting when you are getting illness, or if you get an injury, it's mainly injury, you get a reaction in the body, and that reaction is the inflammation. So in metabolic syndrome is also some reaction in the body, in the especially the fat tissues. It's a inflammation in the fat tissues, and this inflammation in the fat tissues produce various chemicals. Those chemicals are toxic. Those chemicals are toxic, and they are for longer time throughout the life, and it's generate stay and like that. You don't get the as such inflammation like illness. You don't get fever, you don't get any other pain, no, something like that, but it's there. It's there. You can find it if you do investigations. Some C-reactive protein, it is high. So that's a very good indication that you are in a problem. It can progress into those diseases that I was telling. So that is why it is important to understand this. So basically, what happened is there's a insulin receptor. Insulin receptor is very important for us because that's the one regulating glucose and also fat and proteins and everything. Most of those are the controlling by insulin. Insulin to act, insulin need a, if insulin is a key, it need a keyhole also. With the key you cannot do anything. It need a keyhole. Then when the keyhole then when you get the key and you can open the door. By opening the door, you can arrange this entering or exit, removing of some metabolites, glucose, fatty acids, lipids, triglycerides, and various things, fatty acids, glycogen, a lot of things are there. So see, in that way, these things are going to block, just like you get a keyhole, it's arranged in such a way that you cannot use the key. It may be inside that you get the key distortion. It may be some metal is broken, no metal is fallen out, or something like that. In the same way, that configuration of the receptor for insulin is changed with those inflammatory markers. That's very easy to understand because this knowledge should be there. With the YouTube and everything is there. It should be there. It should not be a sophisticated knowledge only with doctors. It should not limited to only to doctors. There should be some at least general knowledge for people to understand these things. If you get a general knowledge with these things, and if you discuss with the doctors, doctors also tend to get better knowledge. Otherwise, they think you also don't know. And you also think that doctors know everything. But if you question them, doctor get embarrassed. Most of the Sri Lankan doctors get embarrassed. So this fellow is asking me something that I also don't know. So the doctors tend to read something, listen to read articles, listen to a podcast or something like that, and they tend to get more. Otherwise, they are going to just earn money and money and sleepless nights with private practices, and they don't learn. And that is not good for the doctor's treatment's quality. It's not good for the quality of treatments. And so that you should understand about metabolic syndrome. And I told that insulin resistance is the initial issue. That is because of the inflammation. So what we have to find about inflammation. Inflammation is that the best indicator of you have a inflammation in the body is the belly fat, abdomen or protruded abdomen. If it is in America and Canada, it's or Europe, it's more than 40 inches for male and more than 36 inches for female. It's considered as a feature of a metabolic syndrome. So, but in India and these Sri Lanka, like some South Asian countries, it's less than that. If you have more than 36 inches of this belly circumference, or female it is more than 32, it's not good. It's a feature of metabolic syndrome. So that's a easy way to understand. And then there are some other factors. The real reason is that the belly fat is going to indicate you have visceral fat has a problem. Visceral fat is ill now. Visceral fat, that is the one part of this belly fat. Belly fat is a indicator of metabolic syndrome. And that is the initial point of this problem. So that's very important. That is the one cause in blood pressure. That's the one cause in glycerides in the blood, triglycerides in the blood. That's the cause for fasting blood sugar, increased fast. That's the cause for the lowering of good cholesterol. That's HDL cholesterol is low. So those 5 criteria are there, and blood pressure. Those are 5 criteria. Out of those, if you have 3 or more, that is metabolic syndrome. So we will go into understand about the belly now. The belly fat. Belly fat is that it's a good indication I told, because people think that the belly fat is under the skin. No, it is not under the skin. That fat is not a problem. The belly fat is not that problem. The belly fat is the fat covering our organs, liver, pancreas, stomach, intestines, colon, everything covering our organs. And that's the same fat spread within into to a sac. There's a sac in front of the intestine, below the stomach. That the sac is going to fill up with fat. That's going to indicate you have higher amount of visceral fat, too much. And what happens is, when this fat get increase in size, and you get the blood supply lowering of blood supply. Lowering of blood supply is going to give us the oxygen higher demand. When when the blood supply is not enough, for that the enlarged or swollen fat cells, then the cell is going into a oxygen lack. When there's oxygen lack, that is injurious to the fat cell, and it's going to react and attempt to do something. So that's what the various chemicals are there. Then those chemicals are going to secrete. If I tell those chemicals, just to know, interleukin 6, interleukin 3, tumor necrosis factor, and various cytokines. And those chemicals are the one that I told earlier that going to disrupt the insulin receptor. This is a vicious cycle. When the insulin receptor is blocked, then the pancreas is going to get a feedback saying no, insulin is not enough, insulin not enough. That's but it's not going to get a detail saying that there's a receptor has a problem. But the pancreas is going to, it has enough of insulin secretion capacity, so it's going to increase insulin more and more and more and more. When insulin is more, that's going to increase more and more fat. More and more fat. Then the swelling is more because of the insulin, higher insulin. Although it is partly the blocking is there, but still there are some other receptors upregulated to get more and more fat into the cell. And also insulin cannot control that much of this fatty acid release also. It can very well control glucose, but the fatty acid releasing this is not regulated with this weakened insulin. So that fatty acid also release into the bloodstream, this fatty acid. So when the bloodstream has more and more fatty acids and those chemicals, then that is getting upset the entire system of the body, the muscles, liver, and the fat tissue itself. That the oxygenation process is not working properly. So it creates some more and more chemicals and more oxidized particles, hydroxyl ions, and various things are there. That's what we call, we want to prevent it, antioxidants. You may be knowing about antioxidants. Antioxidants are going to remove the oxidants. The oxidants are more and more created when without insulin it's unregulated, and when when it has more and more fat. Don't think these are very complicated, but it is very easy to understand if you go through this video several times. And then this is the important indicator. And even glucose is a stress for the cells, and then that's also leading to inflammation. And then when the oxygen lack, the fat is going to think that it's going to die. So then there's another pathway is going to stimulate when it is going to die. And so all those are going to give rise to inflammation. These inflammatory and fatty acids can damage endothelium, that is the inner layer of the blood vessels. Inner layer of the blood vessels are getting toxic chemicals because of the inflammation. So inner wall of the blood vessels are getting into trouble, and then it's like injuries causing smoothness removal, and it is injurious. So that then these various white blood cells, macrophages, all collect there and form a plaque that is called atherosclerosis. That's also inflammatory reaction. Just like an injury, outside injury, you see this swelling and this pus thing, and all those, the similar thing is happening inside the blood vessels. Now when it is scarred, it is very irregular surface. With the irregular surface, you can get more and more clotting. And clotting, and these platelets also adhere to those. When it is smooth, it won't adhere to this thing. But this is going to adhere to this irregular surface. And also the fat cells has some other thing, that adiponectin is going to prevent this addition of platelets. And that's also when it is ill, adipose tissue means the fat tissue, and when that is also ill, then we don't get much of adiponectin. Adiponectin is a hormone. So it is you have to understand this. Fat tissue is not just fat, it is a gland, endocrine gland. Now endocrine gland is ill. This is the problem. Your belly is a ill gland, disease gland, inflamed gland. So that's why it's important. And then these things, once these enter, and the endothelial damage is initially it's going to cause blood pressure, high blood pressure, and later it can give rise coronary heart disease if it is affected on this thing, and if it is affected on the heart, if it is affected on the cerebral brain vessels, then it's going to affect the strokes. And also when there is inflammatory these things in the blood, that's going to, in the brain you can get Alzheimer's and Parkinsonism. So those are the possibilities. So all those things are initiated by that inflammation. And even cancers also. So I told about that these oxidants are also released because of this. Mitochondria is getting too much of fat, free fatty acids, and it cannot work properly. It try to work, but then those oxidants release into the blood. The antioxidants may not be able to do that much of works, that much of a control. So that this is the basic idea you can get from about the metabolic syndrome. And there are 5 criteria in metabolic syndrome. Those are there in my description, but because otherwise this video is difficult now. But some people want to go into detail, some people don't want to go into detail. That's why I add this thing in the description. So if you want to go into details, go to description and find it. And if you find this interesting, to subscribe. And if you find this interesting, you can share it with your friends, both female and male, because that is helpful for your friends to get away from the cancers, heart attacks, strokes, Alzheimer's and Parkinson's. Usually friends, that's important. That's important. At least you have 1 or 2 friends, or you genuinely friendly. Though with them you can share. Okay, thank you very much. I will do a second one, how to control this one. Thank you very much for watching this video.